Hello everybody and welcome back to my blog. It's been quite a week this week, as you may have seen on my social media, so I hope you'll forgive me for doing a topic which I know so well that it's easy for me to do, and also it's something that people have been asking me for, and that is just answers to the frequently asked questions on menopause, because it's all very well having the big videos, but there are always niggly little questions afterwards. So that's what I've done today. I'm just answering the questions that I get asked most often. So the questions that you get now are the ones that I get asked repeatedly in the Latte Lounge and in the Menopause Support Network, where I advise people. So just to start with, the first question I get all of the time is, how will my menopause be diagnosed? Do I need a blood test? And that's really simple. If you're under 45, yes, because we need to make sure that it is menopause that's giving you the symptoms. If you're over 45, no blood test. And that's because the blood tests fluctuate wildly. So one day it'll look like you're in menopause and the other day it'll look completely normal. So over 45, it's a clinical diagnosis, and what that means is your GP will take a history and from the history can diagnose you as in menopause or not, perimenopause or not. So that's that one. The next one is, I have a womb, do I need to take progesterone with my HRT, or can I just have estrogen? And the reason we get asked this is because progesterone often gives symptoms to people, side effects, so they don't like it. So they would much rather just have the estrogen that sorts out the hot flushes and the brain fog and the joint pain, etc. So the answer to this question is if you have a womb, I'm afraid you must have progesterone. There is no alternative, and that can be in the form of a tablet, a patch, or a Mirena coil. But you can't just have estrogen alone. That's dangerous. So I'm afraid there's no short answer to that one in terms of skipping the progesterone. Okay, so the next one is accepting that I have to have progesterone. If I'm taking it as a tablet, so Progesterone, when do I take it? So the answer to that is that you take it at night time, and you take it 2 hours after food, although that's less important. But taking it at night time is really important because it's sedative. So if you're struggling to sleep, the good news is that the Progesterone will help you to sleep. And so following on from that, the next question I often get is, can I have the gel or can I use the gel that I have for the estrogen at a different time to the progesterone, or do I have to take them together? And the leaflet says you have to take them together. The leaflet is wrong, so don't worry. You can use the gel each day whenever it's convenient to you, and you take the progesterone at night. So some people are taking them together, both at night time, but some people take the gel in the morning and the progesterone at night time. So quite simple, it doesn't matter. Can I use progesterone vaginally instead of swallowing the tablet? And this is Progesterone we're talking about here now, again. So the answer to that is yes, you can. So if you're using a Progesterone capsule that you swallow and you're getting lots of side effects, so bloating, breast tenderness, mood changes, sometimes those side effects can be minimalised by taking it vaginally. And by that, I mean taking the capsules, exactly the same ones that you swallow, and popping them up inside your vagina as high as they will go. Now I know on the packet it says oral. It used to say oral or vaginal, but now it seems to say oral, but you can use them vaginally. And the reason that you don't get as many side effects when you do that is that it is only absorbed locally to the womb, keeping the lining suppressed, which is what you want it to do. So yes, you can. Then I get the question following on from this about, well, what about the 200 milligram pessaries that are designed for the vagina? Wouldn't that be better? Shouldn't I have those? So the answer to this is mixed. So there is no problem having those, and they do exactly the same job, but they're not licensed for HRT, and that's not necessarily an issue. We can use things off license. They're actually licensed for fertility treatment, but they're very expensive compared to the Progesterone capsule. So your GP and your CCG probably won't allow you to have the pessaries. A, because they're not licensed, and B, because they're expensive. So most GPs will only let you have the Progesterone capsule, and some of them won't even let you have those now because the CCGs are saying no. I'm not sure why. So if you get the pessaries, the 200 milligram pessaries, it's not a problem. It will do the job that you want it to do, but quite often you won't be able to get them. So just use the capsules vaginally, and that does the same job. And if you have to take 200 milligrams a night, you'll take 2 capsules and you'll use those vaginally. Okay, so I quite often get told in the menopause support network that a GP has said to a patient that they can't have HRT because they still have periods. So one of the questions that I got sent in is, can I have HRT if I still have regular periods? And the answer is yes. It's as simple as that. You would have to have what we call sequential HRT, so the HRT that mimics your natural cycle, so you still have a period. But yes, you can. If you're having symptoms of menopause, you might still be having regular or irregular periods, and you need to treat the symptoms. So yes, you can have HRT, and it's really important that women know that, because you could be in perimenopause for 10 years and be suffering for a very long time waiting for your periods to stop. So quite often get asked about people that have had a blood clot, a DVT or a PE, or they have a blood clotting disease like factor V Leiden disease. And can they have HRT? Because they quite often get told they can't, and that's not strictly true either. So if you have estrogen, because that's the culprit here, delivered through the skin, so transdermally, as either a patch or as a gel, there is no increased risk above your actual risk of a deep vein thrombosis or pulmonary embolism, PE. So the answer therefore is that if taking HRT that way does not increase your risk any more than it already is, then there is no logical reason why you can't have transdermal HRT. And I have discussed this with a haematologist, because I have patients with this issue and they have said yes, they can have transdermal HRT. So you might have to find the right person to talk to and get referred to a specialist, but just because you have those issues doesn't rule HRT out for you. So the next question that comes from that is, I've had a stroke. Can I have HRT? And the answer is actually the same. So it sometimes depends on what caused your stroke. Was it high blood pressure? Was it an aneurysm? But if it was a clot that's been thrown off from, say, atrial fibrillation in your heart, having HRT does not actually increase your risk of a clot above that of your risk as it already stands. So in theory, again, under the guidance of a specialist, either your stroke specialist or a haematologist, there is no logical reason why you couldn't have transdermal HRT. And I do have one patient who has had a stroke who is using HRT, and I have discussed it with her stroke consultant, who agreed that we could do that because she was suffering so terribly badly with symptoms that it was almost cruel not to treat it. So that's the answer for stroke as well. Now, I often get asked, where do I put the patches? Because in the leaflet it says they have to be below the waist. So the answer is that ideally they go below the waist, and a lot of women put them at the top of their buttocks or on their thighs, and that works fine for them. But for some women it doesn't work fine. It rubs on their clothes or their knickers, or their sweaty are there, so they come off. So some women do put them on their upper arms, inner upper arms, where their fattier area is, and that's fine. Because again, if you think about it logically, the transdermal preparations from HRT patches is going directly into the bloodstream. That's how it works. So it doesn't really matter if it's going directly into the bloodstream on your arm or on your thigh. So if you want to put them above your waist, you can. The most important thing is that you don't put them near your breasts or your genitals. So that's the answer there. And then how do I make the patches stick? So this is a big problem. And a lot of women find that they peel off before they're due to be changed. That gets quite stressful because you're using up your patches quicker than you need to, and then you won't have enough left. So the advice I always give is this: make sure the skin is really, really clean. Use an alcohol wipe over the skin, then wash it with soap and water, then dry it, and then don't put the patch on for at least 30 minutes while the skin absolutely dries. And then they should stick for the required time. If they do start to peel off, you can actually just lightly heat them with a hairdryer and then press them down while they cool, and that helps them re-stick. But it can be a problem, especially if women are active, doing lots of gym, sweating, or if they're naturally sweating. And then what I do in that case is I recommend they change to the gel and Nutrigestan. So then the question about periods comes up. Do I have to have a period? You know, I'd rather not have a period. Can I not just go straight on to the continuous HRT and not have a period? So the answer to this is, it's not dangerous to go onto continuous HRT where you don't have a period earlier than the guidelines suggest. So the guidelines suggest that you should have not had a period for a year before starting continuous. But if you haven't had a period for 8 months and you want to try and keep it that way, you can. However, there's a much higher likelihood that because you've still got some background hormones circulating, giving you a cycle, that once you add in HRT, you might then start to bleed erratically, and then the continuous is actually not doing anything for you at all. In fact, it's making it worse because you're getting bleeding all the time. So in the main, if you haven't had a period or a period-free gap for a year, then you should go on to the sequential for at least a year before switching, where you do have a period. But if you feel really, really strongly that you don't want to have a period, you could try the continuous and see if it's going to work for you. If you start bleeding, you know that it's not going to work for you, and then you need to switch to the sequential, where you have a bleed every month, and then try again after a year. Okay, so I've been asked a lot lately, I've got diabetes, can I have HRT? And apparently there used to be suggestions that you couldn't have HRT if you've got diabetes. It's not true. I can dispel that myth, and if you've got diabetes and you're suffering and you want HRT, you can have it. Will it make me put on weight? Now, this is something I hear all of the time. So the answer is no. HRT does not make you put on weight. What makes you put on weight is menopause. In fact, what it does is it shifts your weight around. So you start to lay down your weight around your tummy, so you get bigger around the middle, and obviously that makes you feel like you're getting fatter because nothing does up and clothes start to feel too small. In actual fact, having HRT should help you be able to shift that, not lay down the weight around the middle. It changes your metabolism slightly, and so the definitive answer is no. HRT doesn't make you put on weight, menopause does, but so does getting older. Please don't forget that your metabolism changes, slows down as you get older, and you need less calories. And that's why we gradually put on weight. So that's the answer to that one. How long will it take to work? So how long is a piece of string? It's different for everyone. A lot of women feel the results, getting the hot flushes under control within weeks, literally a couple of weeks, and their hot flushes are gone. I always say that you need up to 3 months to let it settle in, bed in, get rid of any erratic bleeding you might have, and really feel the benefits from it and know whether or not the dose is right or whether you need to increase it. So it's a gradual thing. You'll see some changes quite quickly and then the rest of them over 3 months. How long can I stay on it? So this is really important because there's another urban myth around this where people seem to think that you have to come off it after 5 years, and it's just simply not true. The NICE guidelines say that under the age of 60 there is more benefit than risk to HRT, and over the age of 60 it needs to be a discussion between you, the patient, and your doctor, a risk assessment to make sure you've not got any cardiac disease or any other disease processes which would be a problem with HRT, and as long as that's all fine, the choice is yours. And I've certainly got women into their late 70s who are still on HRT and have no plans of coming off unless something happens along the way, and there's nothing wrong with that either. So enjoy. Do I need contraception? So the answer is if you're still of reproducing age, so before your periods have stopped essentially, yes, you need contraception. So unless you have a Mirena coil as part of your HRT, you will need to have contraception on top, which most commonly we use the progesterone only pill for. So it does mean that you have to take HRT and a pill. We generally assume women over the age of 54 are no longer fertile, but women younger than that, but still 50 and over, do get pregnant. So Yes, you do need contraception, and I have done a whole separate vlog on this if you want more detail. So the real big one, I've got a family history of breast cancer, so my GP says I can't have HRT. Well, again, it's not strictly true. So obviously if your family history of breast cancer is really strong, you would need to look at that, assess your personal risk, probably see a geneticist, and work out whether or not the benefits of having HRT outweigh the risks. Don't forget, put it into perspective, you are more likely to get breast cancer if you are overweight or drink alcohol than you are having HRT. So the risk of breast cancer on HRT is minuscule, perhaps an extra case per 1,000. So it really is tiny. So if you have a family history of breast cancer, that does not rule you out for having HRT. So now the really big one, I've had breast cancer personally, can I have HRT? So at the moment, most doctors are going to say no to that. However, there is a lot of research to say that even that's not strictly true, even if it was estrogen positive, the receptors. So there's a very good book by a professor from America called Estrogen Matters. His name is Avrum Bluming, and I will put a link to his book in the notes afterwards. And he very much advocates that you can have HRT even if you've had breast cancer, and he has some very logical reasons behind that, but I'll let you investigate that for yourself. But the answer I think that I want you to take away today is it's not an absolute no, but it does need specialist input from oncologists who are up to date with their menopause treatment. I've got high blood pressure, can I have HRT? So HRT we don't think causes high blood pressure, but ideally you shouldn't have high blood pressure when you start it. So as long as your high blood pressure is controlled with medication and is back in normal range, then yes, you can have HRT. When you start it, we will check your blood pressure after 3 months. As long as it's still in normal range, you then just need a blood pressure check once a year. So it's in your interest to get high blood pressure treated anyway, because high blood pressure is a risk for stroke. And once it's treated and in normal areas, then yes, you can have HRT. Can I start HRT when I'm in my 60s? So this is a tricky area, but the answer isn't no. If you've gone more than 10 years from your menopause without having HRT, you may have developed heart disease. And if you've developed cardiac disease where you've got plaques in your blood vessels, which could become dislodged and cause you to have a heart attack or a stroke, then HRT could precipitate that. So the answer is you can start HRT in your 60s, and I certainly have started women in their 60s on HRT, but your doctor needs to do a careful risk assessment of you to make sure that you haven't got any developing heart disease or risks for other diseases that would prevent you from having it. So it's a trickier situation, but it's not a no. And we would always start you on the lowest dose possible and through the skin, not as a tablet. Okay? So, those are the questions that were sent to me and asked of me in the main on the Menopause Support Network. And hopefully that's answered them for you if you're thinking about them. If you've got more, and I'm sure there are more, I mean, they're kind of endless, but I'm sure you've got more, just pop them into the questions, the comments box afterwards, and I will answer them for you there. And you can always join the Menopause Support Network and I will answer them for you in there. So I hope you've enjoyed it this week. I hope I've answered those questions. And thank you as ever for listening. It really, really is appreciated. I realise that I got my lighting wrong today, so I think I've got a big shadow here. So I apologise for that as well. But I've been a bit scatty this week and it's not menopause. Take care. See you soon.